Good afternoon, everyone, and welcome to TBR's webinar, Expanding the Role of IT in Healthcare Delivery, Insights from TBR's Healthcare IT Services Benchmark, which focuses on the recent performance results of vendors in TBR's Healthcare IT Services Vendor Reports and Benchmark. I'm Allison Crawford, and I'm hosting today's webinar. The Healthcare IT Services, or HITS market, continues to strengthen and expand in the U.S. and internationally. Individual service providers are identifying market niches to secure leadership roles and expanding the use of alliances and partnerships to best coordinate go-to-market approaches. New technologies like mHealth and telemedicine are changing the way caregivers provide services, and these new HITS tools are being used to improve outcomes. Before I pass this over to John, there are a few housekeeping items I'd like to cover. First, we're recording today's session and we'll be posting it to our YouTube site, TBRI channel. We encourage you to visit our channel to watch this presentation or any of the others that we've posted. Second, we'd like to hear your opinions and thoughts on the materials we are presenting. Please send any questions or comments to the Q&A or chat function. John and Jacob will address them at the end of the presentation. Or if you'd like to set up a client inquiry for more detailed discussion, please reach out directly to either analyst or myself at the end of the webinar to set up that private conversation. Third, we'll send out the slides to everyone registered for today's webcast within 24 hours of the conclusion of the webinar. You can also find these slides as well as other thought leadership pieces, webinar decks, and commentaries on SlideShare at www.slideshare.net/TBR_market_insight. And I'll share all the social media links with you again at the end of the presentation. Now let me introduce Senior Analyst John Cossis. As a Senior Analyst in TBR's Professional Services practice, John is an expert on business models used in IT consulting, management consulting, IT outsourcing, business process outsourcing, application development and maintenance, and systems integration. He has managed the Healthcare IT Services program for 4 years, and his guidance has given vendors actionable insight into successful strategies and business models used in the healthcare IT industry. He'll also be joined by analyst Jacob Gordon at the end of the conversation during the Q&A portion of the presentation. And with that, let me hand this over to John.
Thanks, Allison. Hello, everyone, and welcome to Technology Business Research's Healthcare IT Services Benchmark Review. Thanks for joining us today. My name is John Cossis. I'm a senior analyst and the manager of the Public Sector and Health IT Services practice here at TBR, and I'll be the presenter for today's session. I've been an analyst with TBR since 2001, and as Allison mentioned, I've directed the Health IT Research Program for the last 4 years. TBR's focus within the Health IT Services market is to provide company-centric research to accelerate our customer success. The information that we will be reviewing today comes primarily from TBR's Health IT Services Vendor Benchmark for the second calendar quarter of 2014, which henceforth through the presentation I'll refer to as 2Q14. This detailed report includes information on vendor strategies, strategic actions, and key developments during the quarter, alliance and acquisition activity, and overall fiscal and business line performance. The information within our Health IT Services benchmark report and the information that our Health IT Services team delivers is really an invaluable supplement to any vendor who is looking to expand their footprint or compete more effectively in the global healthcare IT services market. So we're excited to present the findings from our most recent Healthcare IT Services Benchmark study with you, and we look forward to receiving your feedback and responding to your questions about the information that we share with you today. So today I'm going to discuss 3 primary topic areas from our most recent Healthcare IT Services Benchmark study for 2Q14. First, I'm going to cover some of the key financial results from the second quarter benchmark report, which did publish earlier this month, and I'll focus in particular on revenue and margin performance. From there, I'm going to move to discuss how some companies have responded to the market environment within their operations, within their portfolios with respect to their offerings, and how they're leveraging partnerships and acquisitions in their businesses. And then finally, I'll spend a few moments at the end of the presentation talking about the outlook for the remainder of 2014, and from there we'll take your questions. So we'll begin by reviewing some of the key financial metrics from the most recent benchmark study for 2Q14 and how the conditions in the current health IT services environment impacted vendor fiscal performance. In particular, we're going to focus on trends in revenue growth and profitability and discuss the drivers behind the leading fiscal performers. So let me take a moment now to orient everyone in the audience to the graphic on this page. The blue line that you see here represents the average total year-to-year growth for the 20 companies in the Healthcare IT Services Benchmark Study. The red line is also a representation of average year-to-year revenue growth, but we calculate this metric on a trailing 12-month basis for the benchmark firms in order to smooth out the impact of seasonal events and seasonality. Both of these averages are weighted to account for the size of each benchmark company's respective revenue base in healthcare IT services. What we observed in 2Q14 was that aggregate average quarterly year-to-year revenue growth rebounded modestly after bottoming out over during the course of the first calendar quarter of this year. Using a trailing 12-month approach to smooth out the impact of seasonal factors, we also showed a continued deceleration in the average year-to-year growth rate. And we attribute this most certainly to the impact of the recent trough in average quarterly growth rates in the first calendar quarter of this year. The rebound that we observed in 2Q14 was driven primarily by the acceleration of EHR, electronic health record related deals, as well as EHR deals related to the impending deadline for meaningful use stage 2 compliance at the end of this year. In addition, we observed an acceleration in state government health exchange awards as states award new Medicaid management information systems awards to contractors to address the issues with their Medicaid and health insurance exchanges. Overall growth rates do continue to be buoyed by healthcare organizations across the board, increasing demand for technology solutions that reduce operation costs, enhance the organizational and the overall efficiency of their healthcare delivery systems, IT solutions that improve coordination and interoperability, as well as IT solutions that enhance the capture, storage, interchange, and analysis of medical information. So with that, I'd like to shift gears for a moment and review how the contractors in the benchmark study are performing relative to one another in terms of the size of their revenue base, as well as the growth of their revenue base and their margin performance. I'll take a moment to orient the audience to the graphic on this page. Here we have an illustration of the 20 firms in the quarterly benchmark study and how they position against one another in terms of top-line growth, in terms of margin performance, and in terms of the respective size of their revenue base. This graphic essentially calls out which firms are growing the fastest and which are doing so most profitably. We'll call out the drivers for the margin leaders as well as some of the lacking performers in just a moment. The x-axis on the graphic represents the absolute dollar growth for each vendor's healthcare IT services business. The y-axis represents reported or estimated operating margin for each vendor's healthcare IT services business. And finally, the size of the quote-unquote bubble represents the volume of revenue generated in the quarter through healthcare IT services sales. So the data from 2Q14 showed an average year-to-year growth rate for the 20 firms on a trailing 12-month basis of 6.7. And this we plotted with the vertical dashed red line, while the average trailing 12-month operating margin of 13.2% is plotted with the horizontal dashed red line. Spend a few moments talking about the leading vendors in terms of growth performance, in terms of top-line performance. And we saw several of the competitors on the graphic clustered in the leader section this quarter, owing to a variety of common growth drivers. Deloitte and Cognizant continue to realize traction from their expanding solutions-led IP portfolios. Awards and contract volumes on state-level healthcare work continue to expand for Deloitte. This is also driven in large measure by Deloitte's consulting-led approach and their robust portfolio of analytics. Cognizant's investments in cloud-based platform solutions such as their CareServe and Smart Trial solutions are winning new work in the healthcare field overall, and specifically in life sciences. And its acquisition, which I'll speak to in a few minutes, its acquisition of TriZetto in September, we believe will absolutely fuel an acceleration in Cognizant's top-line growth for its healthcare IT services business in 2015. Cerner's growth continues to stem from its solutions in population health, as well as in health exchange work, patient portals, enterprise data warehousing, and clinical process optimization. Accenture's growth in 2Q14 was supported primarily by add-ons to the healthcare.gov award and continued strong demand for its EHR transformation solutions. In addition, we observed Accenture gaining traction outside of its core U.S. market in international markets with its healthcare IT services solutions. CGI has landed a handful of new awards in the state exchange markets, as well as in Canada and in the UK with the NHS during 2Q14. However, given that the growth averages here are calculated on a trailing 12-month basis, the impact of the recent loss of healthcare.gov in the U.S. federal sector and a handful of contract losses in the state government markets has really yet to be fully realized on our trailing 12-month view of CGI's top-line growth performance. We do see that changing going forward, obviously. Finally, Infosys Healthcare revenue was supported primarily by the recent renewal of its contract with Washington, D.C. to modernize the District of Columbia's Medicaid eligibility system. Infosys has also been ramping up a recent award to install and manage a quality assurance center for a U.S.-based pharmaceutical benefit vendor, Prime Therapeutics, as part of a 3-year award. Moving to the operating margin leaders during the quarter, these three vendors have consistently been within our healthcare IT services benchmark study, have been amongst the margin leaders. They were once again in 2Q14, Epic Systems, CPSI, and HCL Technologies. CPSI and Epic sharing driving their leading margin performance through a combination of integration, implementation, and support services around their software and platform portfolios. We also note that CPSI also continues shifting its sales mix to higher margin software through increased add-on work and transitioning trained staff from clinical applications to physician applications. Epic and HCL Technologies also share cost-efficient service delivery mechanisms that elevate their respective profitability and sustain that profitability in the leadership area relative to their competitors on this illustration. The majority of the remaining vendors clustered around the trailing 12-month averages for both year-to-year healthcare IT services revenue growth and operating margin. And across the remaining competitors, the common factors driving growth really centered on the continued acceleration in EHR implementations and integration projects, health exchange work, both at the state government level in the U.S. and in emerging areas such as private and public health insurance exchanges, as well as growth in areas such as mHealth and analytics, also the latter two being common threads that we've seen across the board with the companies in our benchmark study. And finally, on this slide, I'd like to make a few comments on the vendors in the laggards area of the illustration. Beginning with Leidos, and Leidos' healthcare business continues to suffer from the ongoing deterioration in its revenue and in the sales pipeline for its commercial healthcare business, even though Leidos' activities in the federal healthcare sector are generating more positive results. We believe that Leidos also continues to feel the lingering impact of the recent separation from SAIC. across its operations as well as its operating markets, including healthcare. Margin performance for Leidos, both at the corporate level and our estimates for its health IT services business, severely impacted by a large $500 million plus goodwill write-down in its reported healthcare and engineering segment. We believe that a large portion of this goodwill reduction for Leidos was related to assets acquired in 2012 to boost Leidos' commercial healthcare business, specifically the acquisition of EHR provider Max IT. And in addition, this was on top of a small portion of the write-down that was related to health client intangibles that we believe are also attributed to poor traction that Leidos has been struggling against in the overall EHR market. Leidos has indicated that it is currently reassessing its market position in commercial healthcare and the growth opportunity going forward within commercial healthcare. And in fact, we believe that Leidos will continue to double down on the U.S. federal market, its core market, both on the DoD, the Department of Defense, as well as the federal civilian healthcare areas. And evidence of this is certainly its joining the fray to compete for the $11 billion Defense Healthcare Management System Modernization, aka DHMSM, program in collaboration with Accenture and Cerner. We have Harris positioned in the laggards quadrant of our graphic this quarter, and even though we do, I want to note that it's not because of Harris's most recent performance in the healthcare IT services market, but rather the aggregate performance of its healthcare business since the latter half of 2013. I will note that Harris has been restructuring its healthcare business over the course of the last year, which until 2Q14 had really taken precedence for the company, in our view, over driving revenue growth. On the federal health IT side, Harris had suffered a reduction in volume on a number of new federal program wins and declining rates of successful recompetes during the latter part of 2013. Competition intensified in the market, funding levels diminished, both impacting the top-line performance for Harris's healthcare IT services business. But Harris was also at the same time going to market with a new clinical innovation platform, which after a delayed launch only began to gain traction later in the year in 2013. So the ramp-up of new customer additions for this new platform offering did serve to exacerbate the lingering development costs associated with the solution. All of this combined to have an erosive effect on Harris's estimated healthcare IT services operating margin performance as well. However, we see that Harris is turning the corner. In 2Q14, they reported much improved performance on the commercial healthcare IT services business, driven by the continued traction of its clinical innovation platform, as well as the rollout of its Fusion FX offering that was recently introduced. Fusion FX is a vendor-neutral suite of interoperability solutions. In a nutshell, because we calculate growth using the trailing 12-month approach, the struggles that Harris's healthcare IT services business experienced earlier in the calculated period continue to have an impact over the company's relative positioning on the graphic, offsetting the more recent successes. We do expect to see Harris close the gap with its peers over the next few quarters, both in terms of growth and profitability, as it continues to gain ground in commercial healthcare. And then lastly, a few comments about Allscripts. Allscripts is in somewhat of a similar situation to Harris, as during the course of the last 12 months, it has increased its R&D investments, implemented measures to enhance the client experience, enhanced the functionality of its solutions, and invested to expand its footprint in new markets such as population health. The benefits of these investments have really only started to bubble up in Allscripts' fiscal performance in 2Q14, and we believe that this will eventually enable Allscripts also to narrow the fiscal performance gap with its peers through the remainder of 2014, especially as it continues to gain steam with its peers in the areas of professional EHR sales and patient engagement solutions. Its population health management solutions are also gaining traction, as well as its portfolio of care coordination solutions. And I'll also note that Allscripts will realize an accretive benefit to its top line from its recent acquisition of Oasis Solutions in the United Kingdom. So with that, I'll shift to the second discussion area for today. And here we'll do a deeper drill down into vendor activity and activities to align with the conditions and demand trends in the market environment. And in particular, we'll summarize the key developments regarding new solution introductions, new alliance formation, and acquisition activity. So we'll spend a few moments discussing new service introductions during the quarter, much of it being driven by what we've observed as the ongoing and increasing, in some cases, earmarks that competitors across the board within our healthcare IT services benchmark research program are making in research and development to accelerate new solution introductions in areas including analytics, areas such as cloud mobility, as well as interoperability. And in 2Q14, we noted a number of competitors that we've called out here on the slide releasing a variety of new offerings. First, Cognizant. Cognizant was selected by a collaboration of 19 major pharmaceutical companies in an organization known as the Trans-Cellular Biopharma to develop a subscription-based platform that will enhance collaboration amongst pharma companies on clinical trials. This collaboration of pharmaceutical firms selected Cognizant to assist with the underlying research and development of this platform. CPSI, after a series of successful implementation of its relatively new emergency department information system that it introduced within the last 6 to 9 months, and with more expected later this year, CPSI decided to make this emergency department information system application available more broadly across its client base. CPSI also introduced a new ambulatory platform and reports that it has gone live with this with over a dozen healthcare provider clients. Infosys introduced a cloud-based version of its clinical trial supply management solution during the quarter, and this solution is designed to enable life sciences clients to improve the efficiency of and accelerate the clinical trial process by improving the collaboration between pharmaceutical companies and contract research organizations. And finally, NextGen launched its NextGen Share interoperability platform, which is designed to facilitate greater and more efficient data exchange between and across healthcare organizations. NextGen Share is also the first joint solution developed by NextGen since its parent company, QSI, acquired mHealth back in the later part of last year in 2013. So I'd like to then now move on to spend a few minutes talking about notable alliance activity during 2Q14. Beginning with CSC, CSC expanded its alliance with IBM during the quarter. The two companies plan to co-develop and co-offer cloud solutions employing CSC's Lorenzo EHR solution and solutions that will be built on top of IBM's SoftLayer and Bluemix cloud platforms. We also believe CSC will leverage IBM's mobile-first application development platform to build a mobile version of its Lorenzo EHR solution. We see CSC integrating IBM's cloud mobility analytics offerings more deeply into its own healthcare IT solutions, such as MedChart, to transform them into more comprehensive digital solutions that are cloud-delivered, mobility-enabled, and capable of predictive analytics, providing predictive analytics as part of a larger effort for CSC to build out its portfolio of premium price and next-generation healthcare IT services offerings. Accenture and Philips during the quarter, Accenture and Philips formed an alliance to develop analytics technology that will be capable of interpreting human brain waves and which will use tools and software developed earlier by both firms to interpret the data from the solution. We see this alliance as reflective of Accenture's ongoing intent to continue to move up the value chain and become a more deeply entrenched player in the healthcare wearables market, and thereby help consumers and healthcare organizations better understand the correlations between physical activity and improved health outcomes. We also see Accenture positioning itself to become a healthcare wearables platform provider for specialized medical devices, wherein it will provide the software backbone that will integrate the wearables and provide analytics to interpret the data generated. Deloitte, with its Converged Healthcare unit, primarily through its Converged Healthcare unit, we believe will partner up with Intermountain and Forest Labs to study health outcomes. This collaboration will employ analytics that have been developed by Deloitte with the health research, or with research in the health field conducted, I should say, by both Forest Labs and the Intermountain, the purpose of which will be to better understand the factors involved in generating positive patient outcomes. We believe that this trio of partners will leverage the research findings to isolate the factors critical in producing positive patient outcomes, as well as improve the reliability. We believe that this one of the aspects of this alliance that attracted Deloitte was the potential for Deloitte to further enhance the reliability of its predictive healthcare analytics solutions. And then NextGen and 3M. NextGen and 3M plan to collaborate to offer as a web-based solution, a web-based ICD-10 education program. And this program aims to help healthcare provider organizations transition to the new ICD-10 standards by the deadline a year from now. We believe that NextGen will leverage the ICD-10 education program to enhance its physician consulting services portfolio by providing an easier-to-consume cloud-based education offering that will then bundle with its consulting offerings related to ICD-10 to provide a more comprehensive and a more end-to-end ICD-10 solution. But beyond the partnerships that I've mentioned on this slide, far and away the most important development in our view, in TBR's view, concerning alliances during the quarter relates to the DoD, the Department of Defense, and its $11 billion DHMSM program, which I will discuss on the next slide. On August 25th, following a year, essentially, when the DoD issued numerous requests for information from the health IT services vendor community, the DoD opened the bid solicitation process for the DHMSM program. However, coalitions of vendors began to form and enter the fray months ahead of this. Back in June, these coalitions began to come together to compete for a spot on what is expected to be potentially an $11 billion award. The first entrants were IBM and Epic, and I believe that they added, more recently they added Impact Advisors to that coalition. And this was followed soon by two additional teams, Allscripts, CSC, and HP, followed by Accenture, Cerner, and Leidos. And then a fourth team, General Dynamics, PwC, DSS Incorporated, and MedSphere joined the contest in September. Each of these vendor teams brings significant skills and capabilities to the table, and I'd like to spend a few minutes talking about each of the teams here. IBM, Epic, and Impact Advisors certainly benefits from the exceptional capabilities that IBM has and their ability to deliver solutions to scale. IBM has a long-standing relationship with Epic that it has made it a leading global integrator of Epic solutions. IBM has strong capabilities in change management, operations consulting, analytics, and most certainly its Watson technology is differentiating. Epic's unique way of deploying implementation teams using its very highly structured methodology has also made them a leader in the EHR space, as well as within our Health IT Services Benchmark research program. And we see Epic also being able to leverage the deep relationship with IBM to offer its solution to the DoD on a highly serviceable architecture. The CSC, Allscripts CSC and HP team, within that team, CSC and HP both offer solid track records working with the DoD, especially CSC, and CSC is certainly a venerable federal IT contractor and integrator. HP, we believe, has strong capabilities with respect to business continuity, disaster recovery, storage, data redundancy, and the high availability of its solutions. And this combined with Allscripts Open Health Record architecture, we believe will also enhance this team's chances within the DIMSUM competition. Accenture, Cerner, and Leidos, we see Accenture's proven ability to manage high levels of complexity in IT environments as being differentiating, as well as Accenture's rapidly expanding capabilities in both commercial health IT as well as public sector health IT, and its record of commercial health IT implementations making it a formidable competitor in the DIMSUM competition. Cerner also brings to the table strong clinical applications as well as highly interoperable solutions. And Leidos does have a 25-year relationship with the military health system from its days as SAIC. And Leidos, as SAIC, having helped the MHS build an early acute care medical information system, and we believe overall that Leidos and its knowledge, its deep knowledge and experience and expertise of the DoD health IT environment perhaps is unrivaled across the four competing teams. We do, however, have some concerns about the lingering organizational disruptions, some of which I alluded to earlier, at Leidos stemming from the recent separation from SAIC. And then finally, the team that we assume will be led by General Dynamics, likely the prime contractor on this fourth team with PwC, DSS, and MedSphere. As a longstanding and legacy defense and aerospace contractor, General Dynamics, much like Leidos, brings deep DoD experience to the competition, along with the capabilities that it acquired from Vangent, which significantly expanded the depth and breadth of General Dynamics' health IT portfolio, primarily in health informatics, information exchange, EHRs, and data analytics, as well as in health BPO solutions. We see General Dynamics also being able to leverage its deep cybersecurity portfolio as well as its cyber-related R&D capabilities to further enhance the capabilities not only that it acquired with Vangent, but the capabilities that its team members will bring to the table. General Dynamics has also recently ramped up its activity around mHealth and mobility with a couple of acquisitions and alliances, acquiring Open Kernel Labs and its acquisition with Samsung over the last year. And in a nutshell, we see General Dynamics IT working very closely with PwC to do the implementation of the, in our view, robust commercial EHR applications that DSS and MedSphere will bring to the table. So with that, I'd like to move to a couple of comments, to make a couple of comments on the key acquisitions made by health IT services vendors in 2Q14. And although the pace, the volume of acquisition activity was light, the volume of the acquisitions that we did observe were of the strategic variety. Two in particular: Cognizant's $2.7 billion acquisition of Trizetto, will enable it to narrow the scale and capabilities gap with global MNCs like CSC, IBM, and Accenture through an enhanced portfolio of proprietary software intellectual property. The acquisition also adds a client base of 350 payers and I believe 245,000 provider organizations, and also provides Cognizant with an expanded onshore delivery presence, which we believe will be advantageous for Cognizant in the U.S. healthcare market over some of its India-based competitors such as Infosys and TCS. Cerner's $1.3 billion acquisition of Siemens Health Services further amplifies its status as, in our view, a real mover and shaker in the health IT services field. We see this purchase as enhancing Cerner's already robust EHR analytics and consulting solutions, as well as expanding its scale through the addition of thousands of employees, clients, and global locations. And as part of the acquisition, we believe that Cerner and Siemens are going to work closely together to develop new solutions that will combine, on the one hand, Cerner's health IT services capabilities with, on the other, Siemens' expertise in medical devices and imaging. We see the Siemens Health Services acquisition as providing Cerner with the global scale to accelerate its international market share gains and become an even stronger competitor against the leading U.S. One of the leading U.S. EHR providers, for example, Epic. Our final topic area today will be on the growth outlook for the remainder of 2014 for the companies covered in our Healthcare IT Services Benchmark research program. While we do expect some seasonal deceleration in the pace of growth through the second half of the year, we don't believe that the market's overall pace of growth will decline over the long term. In fact, we see it remaining solidly in the mid to upper single digits for as an average for the 20 companies in our benchmark study through the second half of 2014, and we see an increase in momentum in 2015, driven primarily by the continued and rising pressure on healthcare organizations to cut operational costs and integrate health IT systems, and as these organizations continue to and increasingly seek out new health records offerings, as well as enhance their interoperability, cloud, mHealth, and analytics capabilities through the purchase of these solutions. So let me take a moment to orient the audience to the graphic on this page. And here we plotted our estimates for the year-to-year growth of full year, that's the full calendar year 2014 revenue versus the full calendar year 2013 revenue for each of the 20 vendors in our Health IT Services Benchmark study. We anticipate that the growth leaders that we observed during the second calendar quarter of 2014, Cognizant, Cerner, Deloitte, Accenture, and Epic, will continue to sustain double-digit rates of top-line expansion for the remainder of calendar 2014, owing to similar factors, continued traction in EHR solutions, continued traction in cloud-based platform implementations, analytics, as well as public sector exchange and other implementations of health IT systems. We expect most of the remaining vendors that we've shown here that to sustain positive top-line growth for the rest of 2014, owing to many of the same market factors and collection of market factors as the leaders. I want to take a few moments to talk about the three vendors that we believe will see a modest to significant contraction in their health IT services revenue bases in 2014, beginning with McKesson. And our estimate for McKesson's calendar 2014 top-line growth is based primarily on the performance of its technology solutions business, which earlier in the year had its revenue performance negatively impacted by the softness in its clinical software platform business, as well as the planned consolidation and disposal of some of the more challenged areas of its portfolio. However, Moderating the impact of these items will be the continued growth of McKesson's analytics, connectivity, physician services, and medical imaging business lines, which we believe will enable McKesson, according to our estimates, to realize only modest contraction in its top line for calendar 2014. We see McKesson continuing to accelerate its growth in 2015. With respect to CGI, despite a handful of state exchange wins and traction in international markets, we see that the CGI's full year 2014 revenue will finally feel the impact of the healthcare.gov loss, as well as a handful of other recent state-level exchange issues. And then finally, Leidos, we don't anticipate a significant rebound in 2014 for Leidos' commercial healthcare business, which is the primary driver behind the more than 20% contraction that's expected in Leidos' healthcare business for 2014. And this is primarily as the company continues to work through the internal disruptions following the SEIC split, while it refocuses on its core federal health market. 2015 is most likely going to be a better year for Leidos, though they still have a ways to go in reviving the growth of their healthcare business. And in fact, we expect that it is not entirely unlikely that Leidos will slowly move out of the commercial healthcare space and continue to double down on the federal health IT market. So with that, we are now happy to take your questions.
Great. So we had one question that came in. I think the graphic was on, go back to it, right in the beginning. Looks like this one, I think it was, graphic does not seem to support robust growth, 9.4 to 7.1.
Yes, so thanks for the question. When we're also looking at this in relation to the larger global IT services market, which we expect will see during the same period of time much more modest growth. We do note the deceleration in growth during this period, which has been driven by the softness in the U.S. federal market, and the U.S. market accounts for the largest geographic share of our healthcare IT services coverage. We do see that rebounding as we approach the end of 2014, and so we do see improved traction going forward in 2015. There's been a handful of other factors, and certainly the impact of the inclusion of vendors such as Leidos have impacted this growth rate, the growth rates that we're illustrating here as well. But we do see growth perhaps staying at or about the levels that we're showing for 2Q14 here for the remainder of the year, but then picking up as we move into 2015.
Next question we have. Earlier you mentioned the DoD's DIMSUM modernization contract. What do you believe will be the most critical differentiators for the winning team?
That's a great question, and thanks for that question. We absolutely expect that the competition for DIMSUM is going to be fierce. As I mentioned earlier, we see each team and each team member will really need to aggressively showcase best practices and solutions, not only in public sector health IT engagements, but also in commercial health IT work. Especially critical, in our view, will be the winning team's ability to provide a scalable solution, most certainly an interoperable solution, and likely one that will bring a significant analytics capability and have that analytics capability layered on top of the solution, as our understanding is that the vast majority of the data that's currently in the DoD's EHR systems is unstructured. I think the figure that I've seen quoted is about 80% of that data is unstructured. So that really underscores the need for a scalable and robust analytics capability to be layered on top of the ultimate solution. The team members also with the deepest understanding of the military health IT environment will absolutely have an advantage. I mentioned Leidos earlier, certainly CSC and HP. They'll certainly have an advantage in terms of understanding the challenges around migration, conversion, and the integration required for transition and parallel services. Certainly the team with the deepest DoD health knowledge and experience will be the most successful in providing a solution, and this is key in our view, a solution that also has a high degree of predictability and visibility for the federal IT buyers on the other side of the table. I also believe that one of the other challenges for the vendor teams may be how they will meet the federal government's roughly 30% or so small business set-aside requirements, as well as the continued push by the federal government for procurements, and this is across the board, this is not limited to health IT, but the continued push for procurements that are based on LPTA, the acronym standing for lowest price technically acceptable. Procurements based on this criteria, and we see this as being a factor in DIMSUM as well, especially with a project that has this magnitude of complexity associated with it. We believe that the contractors and the teams across the board, much as contractors in the larger federal IT space, have concerns that this race to the bottom, if you will, because of LPTA contracting, by focusing almost exclusively on price, it really represents a threat to the quality and performance of IT projects, and that ultimately LPTA stifles contractors' ability to innovate, propose, and deliver the best solution for their federal IT customer.
Okay, we have a couple more questions in queue, so if anyone has them, please send them through now. The next one we have, you guys, is you discussed vendor activities around acquisitions, alliances, and new service introductions. What other areas have you seen health IT vendors making investments in?
Thanks for the question. During 2Q14, we also observed vendors expanding their service delivery scale. Cerner, for example, finalized its ongoing plans to build a $4 billion campus to further expand its footprint in the Kansas City area. And while this wasn't directly related to healthcare, we also know Deloitte and its plan to build a 400-seat technology development center in Atlanta, where it will develop cloud-based software and advanced analytics products, as it's indicated, for clients across its industry groups, including healthcare. We do expect Deloitte will leverage the center to continue to enhance the capabilities of its Converged Healthcare Business Unit, which I believe was launched back in February. And this is part of a larger effort on the part of Deloitte, an effort that's had Deloitte earmarking $150 to $200 million to develop more robust capabilities in life sciences and healthcare analytics. We see the IT sector in general taking a greater interest in expanding and adding solution centers and development centers and delivery centers in the Atlanta area. We've seen this, as I said, across the board, not just in healthcare IT services, but in the larger IT services market, owing mostly to the highly educated and diverse and generally young workforce in the area. And we do expect to see many of Deloitte's counterparts that haven't already done so in the healthcare IT services area target the Atlanta area for new development service and service delivery centers. I'll note a somewhat similar story that's playing out in North Carolina, in particular in the Research Triangle region, where HCL Technologies during the quarter announced that it planned to spend about $9 million to expand a delivery center there, thereby enhancing its, as part of a larger effort to enhance its U.S.-based onshore delivery capabilities. And we see that HCL will in part leverage the expanded delivery capabilities of the center in North Carolina to offer more healthcare-specific application outsourcing as well as health BPO-related solutions.
Okay, we have one final question so far. The last question right now is, how do you see 2015 shaping up for healthcare IT vendors from a growth and solutions perspective? What areas will be key?
A great question, and thanks for that question. We see a continuation of the effort to improve the overall operating efficiency and profitability of healthcare organizations as one of the primary drivers behind new IT investments in the healthcare arena, along with the ever-increasing demand for IT solutions that really enhance the quality of services, both for provider and for payer organizations. We expect to see accelerating growth in the overall growth rate that we displayed earlier in 2015, and as federal health IT spending does pick up and is supported by a continued acceleration of growth in state government healthcare exchange projects in the U.S. We see a rebound, modest rebound happening in the Asia-Pacific region as more governments in the region increase their own expenditures on health-related IT investments to support growing middle classes in emerging economies such as India and China, as well as established economies such as Japan. We also see certainly the delayed implementation of ICD-10 having now been pushed back to October of next year as a factor driving growth in 2015. Healthcare organizations are taking advantage of this reprieve to train and coach up more staff, which, for example, we expect to see manifested in increased demand for staff augmentation solutions. We see these organizations in the lead up to ICD-10 in October of next year also taking advantage of this opportunity to conduct more extensive testing of the readiness of their existing systems and enhance the accuracy of processes that are in place or being implemented to document health information. All of these factors we expect will combine to sustain solid to robust growth depending on the vendor, but overall we expect to see a modest acceleration in growth for health IT services vendors in 2015. I also want to make a few comments about a particular opportunity where we see potentially outstanding growth, and this is based on comments made to us on the part of the vendors that we follow, that we interact with on a regular basis. And perhaps not surprisingly, the areas in mobile health and mHealth, and this is certainly due to thanks to the ability of mobile health solutions to expand the availability, enhance the affordability of healthcare services, as well as as high-speed data transfer via 3G and 4G markets continues to expand in concert with the ongoing proliferation of smartphones and other mobile devices. We see demand for mHealth accelerating, driven by the flexibility that many mobile computing platforms offer to healthcare providers to, for example, diagnose and treat patients in home and hospital environments. We anticipate that the provider market will likely be the primary driver of mHealth adoption. We've seen this reflected in activities on the part of several of the contractors or the companies that we follow. As these organizations increasingly adopt mobile solutions to improve operational performance and expedite the collection and management of patient data. We also see healthcare IT vendors engaged in efforts to make their EHR platforms more mobile compatible, while also seeking to expand the number and the breadth of mobile applications and mobile offerings for healthcare consumers. Provider organizations will continue to adopt many of these solutions with mobile capabilities. I'll call out a couple of examples that we observed during the quarter, one being Xerox's Juvo Care Performance Platform, which has mobile applications for nurses and physicians that enhance the ease of collection and management of patient healthcare data. We really also see mobile capabilities becoming more of a necessity for healthcare IT solutions, most certainly in EHRs. You know, as folks on the provider side increasingly rely on these mobile devices to manage the healthcare information, vendors are also making their solutions more mobile friendly. For example, as I mentioned earlier, what CSC plans to do with its Lorenzo EHR offering, making it more mobile friendly and releasing a mobile version, in fact, of the Lorenzo EHR offering. And in terms of the overall mHealth market, the projections that we've seen, analyst projections for the global mHealth market suggest that the annual growth for this market could exceed 40% over the next several years, and we think that this is certainly going to attract many new entrants into the space and incent current vendors to aggressively expand their mHealth offerings, both organically and through acquisitions, as well as increased expenditures in research and development. However, we note that it's also going to be critical for these same vendors to address end-user concerns about privacy and security and integrity of health information, as well as the security of the infrastructure that will underlie these mobile platforms.
Great, thanks, John. So we don't have any other questions in queue, so with that, I'm going to start wrapping up. So I want to thank everyone for their time today and for your questions. As I mentioned, I was going to share all the social media links with you, so I do encourage everyone to follow John and Jacob, as well as TBR on Twitter handles listed here, as well as follow TBR for more insight into what's happening both in the health IT market as well as other IT markets. On your way out of the webinar, there's a quick survey. It's 3 questions. How valuable was the content today? How good was the presenter? And if there's any other open-ended feedback you'd like to give us. We are changing our presentations based on your feedback quarter to quarter. So if there is feedback that you can give us in terms of things you'd like to hear more of, things you'd like to hear less of, things you'd like to have us incorporate that we're not covering now, we do appreciate that feedback. So we want to make sure that your time is well spent when you spend it on our webinars. So with that, I'm going to shut down. I'm going to leave the chat function open for another couple of minutes in case there's any last-minute follow-ups that anyone has. And if we don't hear from you now, we'll probably do this presentation again in another 3 to 3 months. So we look forward to working with you guys again then. If there's any questions in the meantime, please feel free to reach out to anyone here at TBR, and we'll assist you with any of your market research needs and what's happening in the healthcare IT market. So thanks, everyone, and have a great afternoon.